Following 12 years of careful studies commissioned by several governments in office in the Virgin Islands to carefully examine the options of healthcare for citizens in the territory, the government of the day delivered on this mandate on September 1, 2015. The mandate of providing equal access to all necessary health services was realized with the official launch of the first phase of the registration process of the National Health Insurance System. The National Health Insurance System, also known as NHI, will provide lifetime coverage. Persons will be given a choice of public or private healthcare providers. Payment for approved medical services will be guaranteed. Access to healthcare will be improved. Early detection and treatment will be ensured, and healthy lifestyles will be promoted. The NHI is a part of government's comprehensive health reform initiative and is designed to ensure that every resident of the Virgin Islands receives good quality health care, which will in return create a healthier territory. Premier and Minister of Finance, Dr. D'Orlando Smith, OBE, said the launch of NHI is a turning point in the history of the Virgin Islands, where active steps will be taken to ensure that all residents of the territory will have access to health insurance. Premier Smith said the occasion was one when everyone can say that they can have access to health care that is good and affordable.
Going hand in hand with that is health insurance. And while it was okay for those who had private insurance and those covered under the government-provided insurance program to get the care needed both here in the territory and abroad, for the great majority who had no insurance, this was not so. And so we decided as a government back in 2005, 2003, that we would work to make sure that all citizens and residents of this territory had access to a national health insurance program. As a medical doctor and surgeon, I've had first-hand experiences of seeing individuals and their families, especially those who could not afford health insurance, saddened by the financial burden instead of being focused on regaining strength and recuperating. I've seen where high out-of-pocket expenses have created grave concerns for those who could not afford to care for their own health or for that of their families. I've seen many instances where people were denied health care abroad because they did not have health insurance. And more daunting, they were unable to raise funds to finance whatever procedure they had to do. Also, I've seen several cases where people had to use their last dollar to access health services, and as such were unable to pay their rent, their school fees, or even grocery bills at that time. And so the government, in many of those cases, had to step in and provide the requisite funding to ensure that those without insurance still had access to quality health care. As a government, we were heavily subsidizing health care, and particularly hospital care. Something had to be done. But we needed a great deal more than we were able to provide at that time. As a physician and now your premier, I could not sit idly by and not pay attention to these myriad challenges and uncertainty that many of our people faced, especially those without insurance. Many countries around the world have moved in this direction. The United States, United Kingdom, Sweden, France, Canada, and the Virgin Islands will all join a number of Caribbean islands such as Bermuda, Cayman Islands, Turks and Caicos Islands, as well as Antigua and others, who all use some form of national health insurance as a principal source of health financing. My government is committed to developing a healthier Virgin Islands and ensuring that all residents have access to quality healthcare services. This move towards implementing a national health insurance system signals progress in taking care of our people and ensuring that every resident of the Virgin Islands has access to healthcare resources and can receive that quality health care. For all of us, National health insurance means that all residents will have access to the kind of health care needed, whether in the near future or in years to come. At a time when our health statistics are showing that very large numbers of our population have already contracted lifelong diseases like diabetes, hypertension, cancer, or heart disease, and we are likely to see these numbers going up in the future. And they provide quite a considerable cost to the people who are suffering. And where we likely see these costs going up in the future, it is important that as a country, we put in place a system which will guarantee that we get the care we need when we need it and when the time comes. Our national health insurance system is a critical aspect of the Virgin Islands' national development goals to achieve health security for all and to strengthen the domestic healthcare system to achieve international standards of performance. A critical component of government's health reform strategy is restructuring the health financing system to provide equitable, cover for all the people of the Virgin Islands through the NHI. From an economic perspective, the implications for economy are also very important. We all know that a healthier population is a more productive population, and the most important resource remains our people. Therefore, we must keep them healthy. My government firmly believes that it is our business to take care of the people of this territory, and over the years we have worked diligently to ensure that we have achieved this. And as I've said, 1 year ago we opened a new People's Hospital and demonstrated our commitment to providing the people of Virgin Islands with access to affordable, high-quality health care. And today, with the launch of the NHI, we signal the start of the registration process to that system for ongoing efforts to take care of the people of the territory. For the individual, what the NHI means is that whenever a health situation arises, it will no longer be a financial situation. In a context where we know that getting older usually calls for more health care and more expensive health care, it is good to have a system that takes care of us as we get older. We will not have to worry about that. Because the system will cover all elderly persons and all children, as working adults and parents, we will not have to worry about health care for our parents or for our children. This is the health security which the NHI brings to us as adults. Further, under the National Health Care Program, very importantly, there is no exclusion of pre-existing conditions, and referral to overseas care is provided for us as with other insurances. As with any new system that is being introduced, we understand that there will be concerns and questions which our National Health Insurance team at the Social Security Board will continue to assist with any clarifications that you may need. This launch is yet another step in strengthening the healthcare system to become even more responsive to the needs of a growing population. We are on a comprehensive health reform agenda, and we are empowering our communities, families, and individuals to take control of their health while ensuring that everyone has access to affordable care.
Director of Health Economics Unit at the Center of Health Economics at the University of the West Indies, Professor Emeritus Dr. Cal Theodore was instrumental in the design of the National Health Insurance Program. Professor Theodore commended the government and the opposition for supporting the work towards the introduction of the NHI. Dr. Theodore, in his remarks, said the National Health Insurance approach is rested on two pillars.
It is an approach that rests on two pillars. There is a health pillar, there's a health need. So the NHI has to reflect what the health needs of the country are. The package that is presented must reflect what the health needs of the country are and what the health needs of the country are projected to be. So that's the first pillar. The second pillar is the financial pillar, the economic capacity of the country to provide the care that we believe is needed. So these two pillars, the system has to rest on these two pillars, and it has to balance on these two pillars. And that is the work that we, the University of Leicester, were invited to help the government with, to help how to set up this thing in a way that it would really balance well. Now, the work of doing that is not easy work. And with all the good, we have heard all the good things that the NHI will do. First of all, it is going to focus, as I said, on what the health needs of the population are, and we're going to try to have a package that addresses those needs. It will make sure that everyone in the country has equal access to that, to this package of care. But it also, all the NHIs are usually set up to concentrate on the prevention side. So the NHI provides support for the ministries of health to strengthen the disease prevention activities that the ministry is involved in. And lastly, and most important, and very importantly, the NHI is also set up in a way so that the cost of healthcare, which everybody is worried about, which keeps going up and up, the NHI is set up in such a way that those costs could be monitored and controlled. Now, when you set up a system like that, what you're saying is that you are taking a step to improve the quality of the health system you have in the country, and you're taking a step to improve the quality of life in this country. Now, these are objectives that are major objectives. There is a challenge, though, that I think I want to leave you with. There's a challenge that we have with it. The big challenge with the NHI always is management. Let me tell you why. You see, the NHI is really, it's, as I said, it is a pool. There is an inflow to the pool, and there's an outflow from the pool. So somebody has to make sure, you know, that the inflows and outflows are operating in a way that the pool does not run dry. Somebody has to make sure that that's happening. And that is not an easy thing to do. But here is where the BVI can be comfortable, because the agency in charge of the NHI, your Social Security Board, has been managing such a pool for the last 35 years. It's the same kind of pool. Right? So I think in this country, people don't have to worry about the management. The management is crucial, but the management of the BVI NHI is in good hands. There's no doubt about that.
Deputy Premier and Minister for Natural Resources and Labor, Dr. the Honourable Catterick Pickering, said the day was a red letter in the territory. Dr. Pickering said the dream is to make the BVI a model as one of the richest countries in the Caribbean, not only in monetary terms, but also in the health of the people. He added that the national health insurance will take care of persons from beginning to end.
And for those of you who are wondering even further, as you get older, when you no longer work in your retirement years, and even if you have the best private health insurance in the world, this is what happens. Your cost of insurance goes up, your benefits go down. That won't happen with the National Health Insurance Scheme. And that won't happen in the British Virgin Islands. Some of the people who are anti-NHI and have been criticizing it talk about what their private health insurance can give them and where it can take them and what they can get. Well, let me say this to them and to all of you who would listen. God forbid if you have an accident. God forbid if something happens to you and you need emergency care. That is what we saw several years ago, that the services that were offered at the People's Hospital were insufficient to take care of the emergent and urgent needs of our citizens.
Dr. Pickering also addressed the concerns of persons who are unsure of the stability of NHI, stating that several years ago, government saw that the services offered at the People's Hospital were insufficient to take care of the emergent and urgent needs of the citizens, and made the move towards addressing the situation.
Reflect with me for a minute. If you remember, right, Sister Pemberton, sitting in the audience, you remember the hospital as it was, the entrance from the seaside, the little room that was then the emergency room at the hospital. We had 4 beds in there, and you used to fall over each other trying to take care of people. If you had an accident, it was a nightmare trying to take care of more than 4 people at a time. Fast forward your minds and compare that now. Those of you who have had the opportunity to walk into the New People's Hospital and see what the emergency room looks like. But somebody's got to pay for it. You can't have a nice vacation and at the end your credit card is just going to stay there and somebody's going to pick up the tab. Somebody has got to pay the bill. And somebody has been paying the bill all the time. What Professor Theodore just explained is that we have found a more equitable system to be able to take care of our bills. The bills are not going to disappear. Minister Skelton has to pull out his hairs all the time when people have to be transferred overseas and then the bill come back to you. I didn't mean that literally, did I? When the bill comes back and says that the individual has accumulated a bill of $150,000 in some hospital in Florida or Puerto Rico, the money has got to come from somewhere. But the system that we are creating is going to ensure that there will be money to take care of those needs.
Minister for Communications and Works, Honourable Vanterpool, was instrumental in the development and success of the Social Security Board over the years and said that he was satisfied that several years from now, persons in the Virgin Islands will be grateful that the National Health Insurance Program was instituted. He said that it takes the will and courage of leaders to put systems and security in place for the benefit of their citizens. Minister Vanterpool added that the vision for national health insurance is solid for the improvement and security of health for the people of the Virgin Islands.
But I want you to understand that your leaders, not just on this side of the aisle, but your leaders believe that this is something good for the territory. Please understand that at the beginning of Social Security Board development, everything was not perfect. It took years of changes to the legislation, years of changes to policy, years of changes to procedure. But over time, it has built to be one of the strongest in the world. It's going to be the same thing for the national health insurance as we develop it. It's going to take time. We're going to have to make adjustments. But I will tell you that at the end of the day, we want you, the people of the Virgin Islands, not just who are belongers, but those of you who reside and work here, to be confident and understand that this is in the best interest of you, the people who live in the Virgin Islands. Ladies and gentlemen, 3 3/4% of your wages you may be concerned about. But I have more concerns than that, because I have had very personal experiences on a regular basis, up to this year many times, when persons not only in my establishment, when persons not only in my constituency, when persons who have come to my office. Is Miss Marlene Pen here? Or Miss Pen from the social office of the hospital? I hope they're not here, because every time I see them, I hide. Or when I see a call from one of them, I think twice. But these folks are trying to make sure to help people in cases of emergency to get to places where they can get attention urgently. And I have had on many occasions, they will testify to you, not just now, not just since I've been in politics, but I have had on many occasions to dip my hand in my pocket when sometimes I couldn't even afford it. And I'll go around and call up on many friends, urgently, within hours sometimes, to raise $5,000, $10,000 cash. When you look on a bed, or when you look in the eyes of that wife, or that husband, or that child of a mother, and you look in the eyes, and you realize that they are urgently in need of getting their mother, or their husband, or their wife, or their whomever relative or friend to be thrown out of here urgently within hours, and they don't have the cash. And the ambulance, I have been on the phone and heard them say, without that cash that you will transfer to wherever, and we have that receipt, we are not leaving from wherever they have to leave to come to fly out that loved one. And the loved one look you in the eye, hoping that you can go there and find some friends to help them raise that cash in a moment. And when you fail, you feel bad about it. But when you're able to raise the money and you got them flown out and they come back and they look strong and healthy, you feel good about it. Ladies and gentlemen, I feel good that this year, that $6,000 that I had to give up some Saturday ago, and that $10,000 I had to find, not $11,000 I had to find some time back, and all those kinds of cash. I am happy that today that I won't have to do that anymore. That's not a joke. That's the truth about it. Under the National Health Insurance Scheme for every single person living in the Virgin Islands. And I say, and I emphasize every single person, because it's important for me to emphasize that. Because there are those of us who may have insurance, and we don't think of our neighbors next to us. We don't think of a mother or father who may not have it. And when the time comes that they need it, our health insurance can't help them. So this National Health Insurance Scheme is about helping others.
Honourable Vanterpool called for selfish thoughts to be put aside and said the focus must be about the health care of the people of the Virgin Islands. Senior citizen Mrs. Marlene Pen Trotman, who's already registered in the program on that day, welcomed the National Health Insurance, adding that one of the benefits is that it does not discriminate because of age, pre-existing conditions, and employment status. Mrs. Pen Trotman said that it will afford persons to access health care that is so important and necessary.
I am sure that there are other senior citizens who, like myself, will welcome this plan. I therefore commend this government for caring enough for its people, and I've heard a lot of passion here. I know there's a lot of love. They do care for us, and they're showing how much they love us and care for us. Whether you were born here or have chosen to live and work among us in these beautiful Virgin Islands, we thank you for implementing this National Health Insurance Program, which will, as our Minister for Health and Social Development puts it, strengthen our health sector, improve our standard of living, and of course, make the BVI a healthier place. Isn't that what we all want?
Yes.
We don't want just to live to be 70, 80, 90. We want those years to be active and productive. We have a lot in our brains that we need to pass on, but to be able to do so, we have to be healthy. I don't know if I should tell you how many over 70, but still very active, and really it is extremely important. And I can't say it, I don't know how else to say it, to impress upon you the importance of this National Health Insurance, which will be coming on board shortly. Oh, and I'd like to tell you, I've already registered. Okay. Another good thing about it, it's not only for BV Islanders, it's for all persons residing here so that they're able to access quality health services.
Minister for Health and Social Development, Honourable Ronnie W Skelton, said after years of studies commissioned by the government in office and careful examination of the options of health care, the conclusion was reached that universal health coverage through pooled contributions was the logical solution from both an economic and human rights perspective.
My conviction strengthened after serving as Minister for Health and Social Development for 2 terms. I experienced I experienced firsthand the suffering of so many families year after year that could not raise the money to pay for their much needed treatment and care. Several persons were struck with illnesses or injuries that caused them to use their entire life savings or sell their land and or or other hard-earned assets to pay for the health care they needed to save their lives, the lives of their children or their family. In some instances, private insurance denied the claims, or the insurance, as Marlene just mentioned, did not work or it ran out. And the government will assist by providing financial guarantees to healthcare institutions here at home and overseas in order to protect our people from being denied care or from impending financial disaster. The BVI Health Services Authority has recorded over $24 million in outstanding obligations. Millions of dollars were leaving our economy every year as demand increased for services that were not available in the Virgin Islands, posing a threat to our economy as a whole. Families complain of the considerable inconvenience and expense of having to travel overseas for hospital services that in many instances could be provided right here at home with strategic partnerships and investment in our domestic health system. We also recognize that the diseases that were costing the most money to treat and striking down our loved ones in the prime of their lives were lifestyle-related diseases that were largely preventable. Healthcare costs continue to escalate rapidly, and so did the rate of illnesses and injuries affecting our people, and diminishing the productivity of our labor force. Something had to be done. We recognize that this health crisis is not unique to the Virgin Islands. Therefore, we investigated healthcare provisions in other countries to see how they mitigated similar constraints and circumstances. We found that countries of the world with the healthiest population and best health outcomes were the ones that provided universal access to health care for their citizens and residents. Universal health coverage involves equal access to needed health care for all people, wherever they live and work, in the formal or informal economy, the poor or the wealthy, the male or female, the young or old. Investment in health not only promotes social stability, but also have multiplier effect for the growth of the wider economy. Simply put, investment in healthcare is good for our country. And so we set out to build a sustainable health system that will, one, promote wellness and prevention, to revitalize primary health care, to promote early detection and intervention, and expand physical access to services. Bring more specialists, doctors, equipment, and services to this territory, and provide health insurance coverage to the entire population, regardless of age, gender, medical condition, employment, or other status.
Minister Skelton said national health insurance is to health care what Social Security is to pensions and employment income protection. He also noted that a great little nation cannot be built without it. He said that it was anticipated that there would be many questions and concerns about NHI, which will be diligently addressed.
Some of us fear that persons earning minimum wage cannot afford to pay $24 a month for comprehensive health insurance. We say to them, I say to them, can they afford not to? This is a peace of mind investment. It must be seen as money in the bank to take care of your health emergencies and peace of mind for our relatives and our wider community. The private insurance industry claims that NHI will cost more. I need to deviate from my ratings. They said NHI will cost more. Over the last 12 years, I have had discussions with providers of health insurance. Without calling names, they all, not all, but most came to the conclusion that NHI is the right system for the Virgin Islands because they all was recording claims in excess of 100% of premiums. And they feel that it was unsustainable. So here it is, we are now building the system. And at the 11th hour, they come up on the radio, they have an old association, and when we needed them, they were nowhere to be found. But persons with private health insurance can do the math and see that entire families can be covered under the NHI at a fraction of the cost of private insurance. Others say that NHI is a good thing, but it should only apply to persons who don't already have private insurance. When we spoke to countries of similar size that have taken that approach, they found it unsustainable. And they are in fact looking at ways to transition to this model. I wanted to put in a phrase out to those of us who much is given, much is expected. So those of us who can afford to pay more, the BVI has an economy that allows all of us, the majority of us, if we want to work, to have a high standard of living. And those of us who are doing well cannot look over our fences and see our neighbors who are not doing well and ignore their plight. This is what the NHI is trying to address. We have even been accused of introducing NHI as a way to pay for the New People's Hospital and reduce government spending on health care. But ladies and gentlemen, the truth is that with the same level of government expenditure, the government will now be able to provide comprehensive coverage for the entire population and not just those who cannot afford to pay. Every resident will have access to our modern facilities and services, whether in the public or private sector, without having to choose between buying groceries and paying for their visit to the doctor. With NHI, they will be able to do both and not have to gamble with their health.
The first phase of registration is now in effect and will see employers and employees being registered. The second phase will begin in October when registration of unemployed persons, including indigent persons, unemployed senior citizens, and persons in custody of the state and their dependent children will commence. A team from the National Health Insurance Office will remain on hand to address any particular questions to the public about the registration process and further clarification on the overall design and benefits of NHI.